Yasmin Richardson, and this is my community health podcast in which I will be reflecting on my learning, experiences, and evolving perspective on community and public health nursing as I have gained further knowledge throughout the community health nursing course. And so, to begin, I watched the video Public Health Nursing, Changing Lives and Communities, and it contained a lot of relevant insight into what public health nursing is and how it impacts the community in a variety of ways. Upon watching the video, one key takeaway from the video that stood out to me personally was the emphasis on health teaching and prevention from the maternal child health nurse named Cherry. While I really valued the perspective of all the nurses who shared their stories and the significance of their role related to public health nursing, the takeaway of providing health teaching, wellness, and disease prevention from Cherry stood out to me, considering it is something that I resonated with, given my personal interest in maternal and child health, which is, I would say, derived from my knowledge of the ongoing disparities that a lot of Black mothers experience when it comes to maintaining adequate health and disparities in their care as well. And when I was doing my research, I found that according to Schillinger, compared to those with adequate health literacy, people with low health literacy also are more likely to experience disparities in health and healthcare access and have lower rates of receiving screening and preventative services. So I would say this takeaway relates directly to the role of the community/public health nursing in helping undeserved populations, considering health education can truly improve outcomes in these undeserved populations, such as Black mothers or those in poverty who may not have the health literacy or knowledge required to maintain adequate health overall or just throughout their pregnancy or when caring for their children as well. Moving on to how this course has shaped my understanding, I would say I believe this course has shaped my understanding of community and public health nursing by, I would say, redirecting my attention to not just solely the individual patient, but also allowing me to focus on the population as a whole, which was kind of difficult considering in the beginning of nursing, we're conditioned to focus on the individual. But when I was doing my reading in our book, according to Stanhope and Lancaster, it says that looking at health from a population perspective provides a big picture view, a clearer view of what is happening in a particular population, and thus provides a stronger position to strategically focus responses. This, I would say, reinforces the idea that the population focus of community and public health nursing examines the health status of groups and also helps identify interventions that benefit these groups as a whole, producing a broader impact, which is something that I would say has broadened my understanding of community and public health nursing. And moving on, I would say in terms of how this course has impacted me personally as a member of my own community, I would say it has changed how I view and see health disparities and inequities, and I would say overall has really made me more aware and observant of the health disparities that occur within our local communities, and that can be things such as food insecurity and poverty. And I would say it has renewed a desire in me to want to help and be a more active participant in change and to be a active participant within the promotion of community health as well. And I feel like I have always known that health disparities and inequities were present. For example, I would say as I talked about, my whole desire of wanting to be a nurse was based in health inequities in regards to the Black maternal health community and wanting to contribute to reducing those disparities that Black mothers experience in regards to the different things I had mentioned. But I would also say that seeing these inequities and disparities in these different environments for myself and also doing more research throughout this course has given me more of an enlightened perspective of how the Black community as a whole is affected by the multiple different disparities that they experience and not just maternal disparities. For example, when I was volunteering at Bread for the City, it gave me an understanding of how poverty and health inequities affect the Black communities when it comes to food and housing insecurity, and how these populations were very present in these environments seeking for assistance. And when I was doing more research, according to an article on the impact of present-day health disparities on Black people, it stated that many Black people face persistent disparities in healthcare and health outcomes, which includes higher uninsured rates, being more likely to go without care due to cost, and worse reported health status. And I feel that when I was volunteering, the volunteering experience showed me how I could expand in multiple avenues of change when it comes to addressing health inequity. And that could be as both a community member and as well as a nurse. And moving on to what I hope future nursing students will gain from this course. As other nursing students come into this course, I hope that they will come with an open mind and that they can gain further knowledge about how health inequities and disparities affect their own communities, and that they know that they can learn how to be active participants in reducing these disparities, not only as a community member, but as future nurses who are also trusted professionals and relied on for both their health promotion and education capabilities. And given that, I feel that knowledge and skills in health education and literacy are essential for success in community health nursing, considering, I would say from my own personal experience, I didn't realize how much impact that could have positively on health of the community. And I would say this is very prevalent within opportunities with community partnerships. For example, while I was doing my clinicals at Washington Health Institute, I got to learn a lot about stigma and the lack of education when it comes to HIV testing and individuals who do have HIV. And I was able, during this experience, to have the opportunity to educate these individuals about managing their health and reducing the stigma about HIV, as well as its transmission when doing testing on different individuals as well. And I feel that learning about it and learning how to educate different populations was helpful to my growth as a future nurse. And I also learned that nurses through community partnerships truly have the opportunity to make a difference and impact the health of the community in a positive way. And I would just say that overall, there were a plethora of things that I learned during my time taking the community health nursing course. And I have gained multiple lessons that I will ensure to carry with me. And I'm sure these lessons will also influence my practice as a future nurse. Thank you.